Dr. Gurha is joining us as well from Batra Hospital on the COVID scare. Dr. Gurha, given now what we're also hearing in terms of hardcore travel restrictions all over the world, Trump, of course, banning travel to Europe, it only seems like it's escalating. We are hearing a lot of reports from Italy in particular on the state of the pandemic and the pace at which it is, in fact, at which the cases are growing. So all those initial reactions that, people were perhaps overreacting that this was a cold and it's actually more severe. Is there merit in that, given the kind of restrictions we're now seeing on travel around the world?
Good morning, everyone. Definitely, COVID is spreading and it is more than a common cold, but still panicking is not going to help. What we need to do is to have everything possible to prevent its spread. From the very beginning, the idea has been to avoid non-essential travel, which is now more and more being enforced, and therefore all foreign travel first is being stopped, more or less, and then even domestic travel, which is non-essential nature, should be curtailed as far as possible. That's one important step. The other thing that we need to understand is the concept of social distancing, which is, of course, become very common on the social media also, that our good old way of doing namaste should replace coming in contact with people in any manner, like handshakes or otherwise. Then cough etiquette becomes a very, very important thing, that people who are having a cough should be coughing into their shoulder or elbow or into a tissue paper which is discarded into a closed bin subsequently. People should avoid touching their face, because typically how the virus spreads is that you touch a surface which is contaminated because somebody else who had the infection touched it. Now, once you touch with your hand gets contaminated, and we have a tendency of touching our face often. Now, once we touch our face, it gets close to our mouth or to our nose and gets into our respiratory system. So we have to avoid touching our face, especially mouth, eyes, and nose. Then frequent hand washing. And it's very important to understand that our Indian culture, as it is promoted hand washing before and after many things. So we should be washing whenever we feel that we have touched something which could be potentially infected, which at the moment is just about everything, especially the frequently touched things like door handles or railings, etc. So we have to wash hands. Hand washing is as good, if not better, than use of sanitizers, because hand washing with soap and water for a minimum of 20 seconds takes away the organic grime, the dust that gets attached to our hands, which is not possible with an alcohol rub. But when hand washing is not possible, then of course hand sanitizers, alcohol rubs are a good thing. We must also, as far as possible, avoid any crowded places, which means for some time now we'll have to avoid places like movie theaters and for malls, etc. Wherever we are, it's non-essential, which can wait for some time, which can wait for a little after we get over all this. And anybody coming in contact, hello?
Go on.
Anybody coming in contact with a suspected patient, would be somebody who's having symptoms like cough, fever, breathlessness, or somebody who's traveled to some part of the world where the disease is highly prevalent, like China, Italy, Korea, Spain, etc. Then these people should wear masks if they are looking after them or they are in close contact with them. Healthy people need not wear masks until and unless they are coming in close contact with somebody who falls into these categories. As of now, most of the cases that we see, that's the reassuring part, are mild forms of disease from which patients are recovering. The mortality figures are around 3.5%. So which is reassuring, and therefore
Dr. Gurha, sorry, we're running out of time. I just have one question for you. If you could just share with me a quick answer. What's helped to prevent the contagion in a highly populated country like India so far? We've of course got a few a number of cases reported here, especially in the south. But given the fact that the peak was in China and the spread in Southeast Asia, and it's now gone directly to Italy, is there any sort of explanation, or are we still is there still a plausible threat for the contagion to also pick up here?
Actually, I think right now, whatever could be the possible explanations would be hypotheses, which are not proven. But the hypothesis would be one that Indians travel internationally much less than what their counterparts in some of the countries like Italy do, or even the Chinese were doing. So therefore, the contacts have been less. Second, which is being propounded, is that we are used to living in relatively unsanitized environments, and therefore our immunities are better. These are at best hypotheses. So therefore, that is why we have been resistant. Also, I think the government of India is, I would say, doing a commendable job by trying to isolate, to prevent the spread, and create facilities for quarantine, self-isolation, etc., for the suspected patients. And yes, I think it's not over yet, so we do not know what holds for us later.
Right. Right, Dr. Guha, many thanks for joining in and assessing the situation for us.